Thank you for joining Eastern Idaho Public Health for this naloxone training. Before we begin discussing opioid education, overdose prevention, overdose response, and the medication naloxone, we want to take a moment to share with you why these trainings and conversations regarding overdose prevention matter. Each year, Idahoans lose their lives to drug overdose-related deaths. Though the total number of lives lost varies each year, these losses continue to deeply impact local communities. These individuals are not forgotten by their loved ones, and we as community members should do everything we can to prevent that number from increasing. This training will teach you how to recognize and respond to an opioid overdose. Opioid overdoses are a medical emergency. If you ever come across what you think is an overdose situation, call 911 immediately. Throughout this training, you may develop questions. There will be a QR code at the end that will link you to additional information and resources. Eastern Idaho Public Health appreciates your time and attention to this important and life-saving training. Now let's begin, starting with opioids. In this video, we will discuss opioids, factors that influence a person's potential to overdose, and naloxone, a prescription medication designed to reverse an opioid overdoses effects. Opioids are a class of drugs used to reduce acute or chronic severe pain. They work by attaching to the opioid receptors within the brain. Once attached, they release signals and block an individual's perception of pain and boost their feelings of pleasure. Opioids are a family of drug classification and are broken up into three parts: opiates, such as opium; semi-synthetic, such as oxycodone; synthetic, such as fentanyl and tramadol. We're going to talk about two types of opioids, prescription and illicit. Let's break down the differences between the two. Prescription opioids are medications prescribed by a medical provider, like your family doctor. They include medications such as oxycodone, hydrocodone, tramadol, prescription fentanyl, and methadone. Prescription medications are regulated by the FDA, the Food and Drug Administration. The FDA monitors approved drugs for safety and quality. Illicit opioids are illegal non-prescription opioids such as heroin and illicitly manufactured fentanyl. Illicit opioids are highly addictive. By now, the word fentanyl has been mentioned a few times, so let's go into more detail about what it is and why you need to be familiar with it. Fentanyl is a potent synthetic opioid that was developed for pain relief and anesthetic purposes. It is approximately 100 times stronger than morphine and about 50 times stronger or more potent than heroin. As we mentioned earlier, prescription fentanyl was developed for pain relief and anesthetic. However, sometimes prescription opioids such as fentanyl are diverted and sold or distributed illicitly. Illicitly manufactured fentanyl, also known as IMF, is produced by the illegal drug market. Once produced, IMF is often pressed into counterfeit pills that look like oxycodone, Xanax, Adderall, and other medications. The DEA, the Drug Enforcement Agency, and local law enforcement agencies are working hard to seize illicit fentanyl from communities throughout Idaho and the rest of the United States. Why do they target fentanyl specifically? Out of the millions of IMF-laced drugs seized by the DEA annually, 5 out of every 10 pills contain a lethal dose of fentanyl. So what is a lethal dose? A lethal dose of fentanyl is only 2 milligrams. Such a small dose can be lethal depending on a person's overdose risk factors. To put the lethal dose in perspective, 2 milligrams is equivalent to the amount on the tip of this pencil, or 3 to 10 grains of salt. What else makes counterfeit pills so risky? The content of counterfeit pills is unevenly distributed. For example, when somebody cuts a prescribed medication in half, they will take a true 50% of the medication in that tablet. This is because it was made in a regulated lab that equally distributes the defined substances in each pill. As I mentioned earlier, this is not the same for illicit opioids and counterfeit pills, and you never know how much, if any, illicit fentanyl is in a pill just by looking at it. Consider the chocolate chip cookie effect. When someone makes a batch of chocolate chip cookies, not every cookie is going to have the same amount of chocolate chips evenly distributed throughout. A similar effect occurs in the production of illicit substances. When substances like counterfeit pills containing fentanyl are made, the contents are unevenly distributed. Because of this uneven distribution, someone might consume part of a counterfeit pill that contains no fentanyl, or worse, a part that contains a lot of fentanyl. The bottom line, counterfeit pills are deadly. Even just one pill has the potential to kill. It is important to note that the illicit drug landscape is continually changing, and new emerging threats and trends are identified regularly. The Drug Enforcement Agency continually releases information about new and emerging trends, as well as overdose prevention efforts. Now you know what opioids are and the difference between prescription and illicit opioids. Take note that there are some unique risks associated with the specific forms of opioids an individual uses and their chosen method of administration. We will discuss this point in greater detail when we review opioid overdose risk factors. However, it is important to understand that there are general risks that can impact anyone using opioids, regardless of their individual risk factors. The risks of taking opioids include side effects such as sedation, constipation, or respiratory depression, such as slow or shallow breathing. Opioid dependence, Hep C or HIV through shared needles, pregnancy complications, and overdose or death. We urge you to discuss the risks of taking opioids with your medical provider when considering treatment plans. You may also consider talking with your medical provider about alternative pain management strategies or other options to manage pain, including over-the-counter medications, physical therapy, acupuncture or massage therapy, exercise, and cognitive behavioral therapy, CBT. Everyone has risks when engaging in opioid use, regardless of if they are using prescription or illicit opioids. Some people are more at risk of overdosing than others. The conditions that affect someone's potential to experience an opioid overdose are classified as overdose risk factors. Overdose risk factors are defined by an individual's age, physical health, the quality of the substance, the pattern of drug use, their tolerance level, the method of administration, history of substance use, and non-fatal overdose history. So the image on your screen visualizes what these risk factors and conditions would look like if they were equally weighted. However, these conditions have different degrees of influence depending on the individual. Here is a more realistic representation of how these factors vary from person to person and contribute to an individual's potential to overdose. This image depicts the risk factors of a younger individual who has a low tolerance level and uses a riskier method of administration with low-quality substances. Though their tolerance is low, they have a large historical pattern of drug use and a long history of substance use. They also have a history of non-fatal overdoses, and their physical health is not so great. How a substance affects this individual will be different than how the substance affects someone else with different risk factors. This is why you need to consider what your personal risk factors are before you begin to use opioids. Certain factors can place an individual more or less at risk of suffering an overdose. We previously discussed how medications are sometimes diverted. Let's talk about how we can properly store and dispose of medication to reduce the risk of medication getting into the hands of individuals it doesn't belong to. One of the most common ways people get prescription opioids that were not prescribed to them is through family or friends. This fact highlights the need for all medications to be properly stored in order to prevent medication diversion and accidental or intentional overdoses. Consider the following scenario. Let's say you have just received a prescription opioid after being discharged from the hospital. You have children in your home and you are worried that they might get into your prescription out of curiosity, knowing that children often mistake medications for candy. Can you see why knowing how to safely store medications would be so vital in this situation? When we talk about safe storage of prescription medications, we are referring to keeping medication out of reach of those it's not prescribed to, namely children, family members, friends, and visitors, avoiding easily accessible places such as kitchens and bathrooms, locking medicine in a lockbox or cabinet, and monitoring your prescriptions by keeping count of pills and medicines. Once a medication is no longer needed, it should be disposed of safely. There are unsafe disposal options to avoid, and there are safer counterparts. Unsafe disposal options for unused, expired, or unwanted medications include throwing your medication in your residential garbage while still in the marked prescription container, or flushing medications down the toilet. Safe disposal options for unused, expired, or unwanted medications include visiting drug take-back locations, the gold standard of safe medication disposal. They are typically found at sheriff's offices, law enforcement agencies, and participating pharmacies, and are available year-round. Check with your pharmacy to see if they accept unused or expired medications. Using a drug deactivation system. There are drug deactivation systems that can be used at home to safely destroy unused, expired, or unwanted medications. Check with your local pharmacy or public health department to determine if they have a drug deactivation system available for you. If there are no specific disposal instructions listed on the packaging label, you are unable to get access to a drug deactivation system, or a drug take-back location is not accessible for you, safely dispose of your medication in your household trash by following these 4 steps. 1. Mix medicine with an inedible substance like dirt or used coffee grounds. 2. Place the mixture in a durable container like an empty coffee tin or empty laundry detergent container and properly seal it. 3. Throw the container in your household trash. If disposing of sharps or needles, label the container sharps. Do not recycle. 4. Remove all personal information on the label of your empty medication bottle. Then dispose of the bottle in your household trash. Now that we have talked about what opioids are and the risks of opioids, let's talk about naloxone. Knowing how to help someone who's experiencing an opioid overdose might feel like an intimidating concept. This is where naloxone comes into play. Naloxone is a medication that is used in overdose prevention to temporarily reverse an opioid overdose's effects. An opioid overdose occurs when there are too many opioids bound to opioid receptors in the brain. This can cause breathing to slow, or in the case of a fatal overdose, cease entirely. When naloxone, an opioid antagonist, is administered, it dislodges the opioids from these receptors and restores breathing function. Naloxone comes in 2 forms, an intranasal spray such as Narcan and an intramuscular injection. It is important to know that naloxone only temporarily reverses opioid overdoses caused by substances like prescription pain relievers, heroin, and illicitly manufactured fentanyl. It is not effective against methamphetamine or other non-opioid substances. Administering naloxone to someone overdosing on other classes of drugs will have no effect. However, other drugs like meth or cocaine may be cut with an opioid. So if it appears a person may be experiencing an opioid overdose, administer naloxone regardless. It won't harm them if they aren't experiencing an opioid overdose. The effective duration of a single dose of naloxone varies, but typically lasts between 30 and 60 minutes. Once naloxone's effects wear off, the affected individual may resume overdosing. We will talk more about that later, but it is important to note that if you are ever in a situation where you need to use naloxone, always be sure to call 911 even if it appears that the individual is no longer overdosing. Before we talk about how and when to administer naloxone, let's talk more about naloxone itself first. Who should carry naloxone? Anyone can. There are a few examples of people who might be at a broader risk for an opioid overdose and benefit from having it readily available. Anyone who's been prescribed opioids, who also has prominent overdose risk factors, including use of other prescribed medications, co-occurring conditions, alcohol or other substance use, anyone who uses illicit opioids or might be around someone using illicit opioids, anyone who may have reason to encounter someone experiencing an opioid overdose. This includes first responders such as law enforcement and emergency medical services, EMS, as well as people working in customer service, healthcare, faith-based communities, and other related sectors. Naloxone does not need to be intended for your own use to access it. You can generally get naloxone from your pharmacist, or the brand of naloxone known as Narcan can be found over the counter. At the end of this training, we will present a QR code with a list of places where you can get naloxone for free in Eastern Idaho. Once you have received naloxone, you will need to store it appropriately. Do the following to keep it in ideal condition. Store it at room temperature. Keep it out of sunlight. Like any other prescription, place it in a place where children cannot reach. Inform others where it is stored in the case of an emergency. Know the expiration date and replace as needed. The shelf life of naloxone is 36 months or 3 years. People might feel hesitant about providing first aid to a stranger for fear of doing something wrong and being punished legally for it. In Idaho, we have 2 laws in place protecting people who are responding to an overdose. The first law is the Idaho Naloxone Access Law. It allows anyone in the state of Idaho to carry naloxone and administer naloxone as long as they call EMS when they use it. This law also allows local entities to distribute naloxone to anyone at risk of an opioid overdose. This law consists of 2 parts. First, it provides immunity to persons giving emergency first aid or emergency medical attention from a claim of damage. In other words, any person acting in good faith and exercising reasonable care may administer an opioid antagonist, like naloxone, to another person who appears to be experiencing an opioid overdose. They can do so without fear of legal action because they are protected under this law. The second part of this law exists to encourage people to call for help if they or someone they know is experiencing a drug-related emergency. It protects both the caller and the person overdosing. They will receive immunity from being charged and prosecuted for 3 specific crimes: possession of a controlled substance, possession of drug paraphernalia, and being under the influence of a controlled substance. However, you must understand that there are limitations to this law. The limitations are probation or parole status may be revoked or modified, individuals may be charged with other crimes, and individuals may be detained and held even though not charged. By now, we have become more familiar with the concepts of opioids and overdose risk factors. We discussed what naloxone is, who should carry it, where to get it, and how to store it. Our next step will be learning how to administer naloxone to potentially save a life. In this drug overdose response training, we are going to focus on administering an intranasal version of naloxone, such as Narcan. Responding to any medical emergency can be overwhelming. If you find a person and suspect that they are suffering an overdose, remain calm and follow the procedure outlined in these 6 steps. First thing you need to do is assess the individual's physical condition and determine if the person in question is experiencing an overdose. This includes checking for a response and signs of an opioid overdose. Common signs of an opioid overdose include the following: the person will not wake up or respond to voice or touch. They have small, pinpoint pupils. Their breathing is slow, irregular, or stopped. Their skin is cold. Second, once you suspect an opioid overdose, call EMS, Emergency Medical Services, immediately. If possible, have someone else call while you administer naloxone. Third, place the person on their back and administer your first dose of intranasal naloxone or Narcan. Narcan is easy to administer. Simply take 1 dose of Narcan and remove it from its packaging. There are 2 doses in each box. Tilt their head back. Insert the Narcan's applicator nozzle into either nostril, then firmly press the plunger on the bottom. If there is no response from the individual after 2 to 3 minutes, give them a second dose of naloxone. Fourth, after administering naloxone, provide rescue breaths. We recommend checking with the agency you work for to determine their policy on rescue breaths. Fifth, once breathing resumes, turn the person on their side to place them in what we call the recovery position. This position helps to keep their airway clear. Remember to support the person's head with their hands and bend their knee out at a right angle to prevent them from rolling over. 6. Stay with the person until EMS arrives to monitor their symptoms. Naloxone may cause acute opioid withdrawal, effects including pain, agitation, and irritability. Be calm and reassuring to the person as they regain consciousness. As we discussed, naloxone has a half-life of 30 to 60 minutes. As naloxone wears off, opioids still circling in a person's system may again bind to opioid receptors, causing overdose symptoms to return. As you stay with the person until EMS arrives, you may have to give multiple doses of naloxone. This is why it is so vital that individuals who experience an overdose access emergency medical services as soon as possible, and why we at Eastern Idaho Public Health are dedicated to preventing overdoses and promoting health education, such as naloxone training, in order to protect individuals, families, and the community. You have now learned how to recognize and respond to an opioid overdose. Congratulations. Before we end this training, we have a few final remarks regarding how to approach the stigma of addiction and how to access community resources. Addiction is a complex brain disorder with behavioral components. People with an opioid use disorder need to have proper treatment to manage their condition and reduce the risk of overdosing. But when an opioid use disorder is not seen as a serious disease, it is usually not treated as such. Stigma is a mark of disgrace associated with a particular circumstance, quality, or person. The effects of stigma may enhance or resume an individual's drug use. Stigma may also reduce the willingness of someone with an opioid use disorder or any other related issue to get the help they need or simply open up to someone else about their situation. To avoid unintentionally stigmatizing words during your social interactions, be sure to use person-first language. What that means is identifying the person before the diagnosis. Examples of this are saying patient or person who uses drugs instead of user. Another example is saying person in recovery instead of former addict. There may be times after responding to an overdose situation or other circumstances that you or someone around you needs to be connected to community resources. Sometimes knowing where a resource is and how to access it can be confusing. At the end of this training, you will see a QR code that links you to Eastern Idaho Public Health's community resource page. On that page, you will find a zip code locator box. Simply input your zip code and click search to be directed to Find Help Idaho's website. Once on the Find Help Idaho webpage, you can search for programs and resources in your area, including food, housing, goods, transit, health, money, care, education, work, and legal services. We would also like to remind community members of the 211 Idaho Care Line. 211 is a free statewide community information and referral service provided through Idaho Department of Health and Welfare. We at Eastern Idaho Public Health thank you for watching this training on opioid overdose prevention and response. We hope this has been an enlightening experience and that you feel more prepared to act during a drug-related emergency. Looking for additional resources and information regarding naloxone and drug overdose prevention? Follow the links below, scan the QR code, or visit Eastern Idaho Public Health.